Good evening, everyone. How do I follow Secretary Kinsley? Could you all please give him a hand again? Not only does he have better hair than I do, that was a great report out. So, which makes my job very simple because you're doing all of it. But it's quite an honor to be here tonight as we honor the legacy of a pioneer in James Bernstein and also recognize trailblazers in their own right who have dedicated their careers and oftentimes their lives to serve those who are traditionally underserved, underrepresented, and oftentimes overrepresented when we speak of health disparities and how they impact certain demographics within our society. So it is not lost on me the significance and the gravity of this moment. As we have our neighbors, as we've talked about in the west of us, who are still suffering the tragic aftermath of Hurricane Helene. So my heart goes out to the family members of the now 180 plus people who have lost their lives as a result of this disaster. But that is why I stand before you today to recommit from the Biden and Harris administration and the Department of Health and Human Service our partnership with the state of North Carolina in the long road to recovery. We are committed to making sure that we support your state partners and your local partners to serve every community impacted within our region. So thank you to President Reese and the Foundation for Health Leadership and Innovation for inviting me here today. And thank you, Secretary Kinsley, for your leadership and your commitment and being an invaluable state partner who fearlessly fights and advocates on behalf of every citizen in North Carolina. As I look around this room, I'm reminded that you are part of the incredible network of individuals and organizations that make up the fabric of our healthcare system. Each of you play a vital role in the comprehensive tapestry of the support and the services here in North Carolina. Whether you're a healthcare provider, healthcare official, community leader, or an advocate, your contributions are priceless. And I'm sure I don't have to convince this crowd, considering the work that you all put in to expand Medicaid and bring much needed healthcare coverage to more than 500,000 North Carolinians. Please give yourself a round of applause for that. So tonight, I want to just take a moment to highlight a few of the top line priorities that of the Biden and Harris administration and HHS that align not only with the Foundation for Health Leadership and Innovation, but many of your organizations here in the room tonight. And the first of which is that of health equity. Health equity must remain at the forefront of all of our efforts. Our administration has made progress in addressing health disparities through our People in Places Thriving initiative, but much more work lies ahead. It is not enough to just provide service equitably. We must ensure that every person in North Carolina, regardless of their background, can achieve their best health possible. And this means investing in preventative care, mental health resources, and accessibility for all, which includes lowering health costs for healthcare across the board. And I'm happy to say that the leadership of Governor Cooper and Secretary Kinsley has proven that they too are committed to these same ideals. Secondly, the importance of innovation in healthcare cannot be overstated. As we transition into a new era of technology and research, we must embrace innovative approaches to improve the effectiveness of our healthcare delivery system. This includes developing new models to provide healthcare services to our neighbors in rural areas and underserved areas, such as developing and deploying telehealth services that reach the most remote communities, and creating data-driven strategies that inform public health decisions. We must harness these tools to enhance the outcomes and ensure that everyone has access to quality health care. And finally, as we continue to face ongoing challenges in our healthcare system, especially in the wake of a pandemic and now a natural disaster, building resilient healthcare systems, much like the one that you have here in North Carolina, is more important now than ever. This calls for partnerships across sectors, bringing together public health, healthcare providers, community organizations, and private sectors, because together we can prepare for future challenges to ensure that our systems are not only robust, but also adaptable to the ever-changing landscape of public health. So in closing, I want to remind you that each of you play an integral part of this mission to North Carolina's road to recovery. And I urge you to remain steadfast in your commitment to make a difference in the lives of our fellow citizens. I want to thank you for your dedication, your passion, and your commitment to public health. It is through your efforts that we can create a lasting change and build a better tomorrow for North Carolina. So please enjoy the rest of the evening and continue the important work together. Thank you.